Catherine Salamone. I work with admissions and marketing here at Western Hills Retirement Village, and I've been here 18 years.
And I'm Tonya and I have been with Western Hills Retirement Village for a little over 11 years, and I also handle admissions and marketing for Western Hills.
Western Hills Retirement Village has been in the community for 33 years, and we have a lot of staff that have been here 10 plus years, from nursing to nurse aides to dietary and housekeeping. Our administrator opened the building and is still here with us today.
We are 110 beds. We do have a short-term rehabilitation unit as well as long-term care nursing and an Alzheimer's and dementia unit that we call Shelter Point. All of our rehab beds are all private rooms with private bathrooms and showers in the rooms. We also have done floor-to-ceiling renovations for our Alzheimer's unit and our long-term nursing rooms also. The Alzheimer's unit, which we call Shelter Point, has a over 700 square foot activity room that has been added. Dining room that is also attached to the activity room, so it is one large room for the residents and family members to be able to visit and do their activities. In our Alzheimer's unit, we do have designated activities staff and restorative nursing staff that are solely to make sure that the residents are completing activities and they're stimulated and stay busy throughout the day, both their minds and bodies. The restorative nursing helps with the physical part to keep them up and walking and continue to be able to help with some of their daily needs as they are able to.
When somebody comes in for a tour of the building, either Tonya or I will meet with the family. We'll take them on a tour of the Shelter Point unit. We do prefer to have the resident come in as well so that Tonya and I and our social worker and the nursing staff can meet with them, see how the individual interacts while they're up on the unit, and then sit down and talk about finances. We are private pay, we accept long-term care policies, and we are also Medicaid certified back there on our Shelter Point unit. So if anyone has a financial need after they come in, they will oftentimes meet with myself. I am the Medicaid community liaison here in the building and will assist them in that process if and when it's needed.
Our nursing staff on Shelter Point have been especially trained in dementia care. We usually try to keep our staff very consistent in our unit just so that they are familiar with the residents and that our residents and family members can become familiar with the staff. A lot of our staff members have been there for 10 plus years, including nursing assistants, the activity staff, and our nurses.
Our Shelter Point unit, it is a smaller unit. It is a secured unit, so the individuals on that unit get more one-on-one individualized care from our nursing and activity staff. There's an activity staff person based back on that unit 7 days a week from morning until evening. They do activities on the unit, but they do also take them out of the facility as well. They go down to Fern Bank for picnics, they go on bus rides, they go out to breakfast sometimes. So they do a lot to keep them up and moving. We do want them to be as mobile as possible. So they are, because it is secure, they are able to move around and walk wherever they'd like to on that unit without us having to worry about them getting out of the unit.
Shelter Point is a 24-hour nursing unit. There is a nurse available 24 hours a day to be able to assist with medication, checking blood pressures, blood sugar, or whatever may be needed. There's also nursing assistants available to help with bathing, dressing, toileting, those kind of things. However, we do try to encourage the resident to do as much as possible by themselves to keep their independence as long as possible. but we are able to be there to help if that's needed.
When an individual is looking for admission onto our shelter point unit, they do come in for an assessment with myself or Tonya and our social worker and our nursing staff. Once it's been determined that they meet the criteria for the shelter point unit and move-in day has come, we usually recommend that they set the room up beforehand so that the individual comes in and sees some familiar pictures and some familiar personal belongings as well. We do provide the hospital beds and the dressers and all the furniture, TVs in the rooms, but we encourage them to bring in favorite blankets, pictures to hang on the walls, things to personalize the room, so that when they come in, we can walk up with the family and the resident, introduce them to the nursing staff. Once up on the unit, our nursing staff will come in, talk with the family, guide them to the day's activities, and then take the individual down to the activity room and get them occupied while the family finishes getting the room together. We usually encourage that the families get them settled and then let us take over after that for the day so that we can get the resident acclimated to the unit. When looking for a dementia unit for your loved one, keep in mind that we are a smaller unit. We have been here on the west side for over 33 years, and we do have nurses that have been specially trained in dementia unit to work with residents with dementia.
Our unit is smaller and a lot more quiet. With it being a secured unit, it is closed off from the main nursing unit, so it's not as distracting and more soothing to the patients who are in there. While there is stimulation, it is not overstimulation. I would like to talk a little about our short-term rehabilitation unit. We are newly renovated with all private rooms. We have private bathrooms with showers in the bathroom. We have a state-of-the-art therapy gym that we are able to do physical, occupational, and speech therapy in. Therapy is 7 days a week. We accept most insurances, including United Healthcare, Humana, Anthem, and Aetna, as well as traditional Medicare. We are a preferred provider for the Tri-Health system, the Christ Hospital, and the Mercy Hospital systems.